Hey there, and welcome. If you or maybe someone you care about is dealing with that all too common knee pain, then you've absolutely come to the right place. Today, we're going to get into what that pain really means, but more importantly, we're going to connect the dots between your knee health, staying safe, and keeping your independence. So let's just start with a question that probably hits pretty close to home for a lot of you. Is that nagging knee pain? You know the one, when you first get up or after a bit of a walk. Is it really just a simple ache? Well, for millions of people, the answer is a definite yes. It's more than that. And a lot of the time, the culprit has a name: osteoarthritis, or just OA. The simplest way to think about it is wear and tear arthritis. Imagine this smooth, cushiony cartilage at the ends of your bones. Well, over the years, that can start to wear down, and that's what leads to a lot of the symptoms people feel. So, does any of this sound familiar? The symptoms are usually pretty clear. Maybe you feel a pain that seems to ramp up the more you do. Or how about that stiffness first thing in the morning that makes getting going a real challenge? You might even notice some swelling, hear or feel a kind of grating or creaking, and just find it's harder to fully bend or straighten your knee. Okay, so if any of that is ringing a bell, the next step, the really important one, is getting a clear diagnosis from a doctor. So let's just walk through what that process actually looks like so it's not a mystery. It almost always starts with just a conversation. Your doctor will ask about your health history and do a physical exam of your knee. From there, they'll probably send you for x-rays to get a look at the joint itself. But here's what's really interesting. What they see on an x-ray doesn't always line up with how much pain someone feels. Sometimes they might need more info from something like an MRI, but usually it starts with those first couple of steps. All right, so once you have that diagnosis, it's time to shift your thinking. This isn't about finding one single cure. It's about building your own personal management toolkit. This is how you really start to take back control over your knee health and, your life. And the very foundation of that toolkit, I'm talking about the most powerful fundamental tools you have. It all comes down to lifestyle. These are the things you can actually start doing right now that can make a huge difference. We're basically talking about 3 pillars here. First, gentle exercise to make the muscles that support your knees stronger. Second, weight management, because every pound you lose takes several pounds of pressure off that joint. And third, activity modification, which is just a fancy way of saying you learn to avoid the things that really stir up the pain. And this is a perfect example of what we mean by gentle exercise. You really want to focus on things that are low impact. Things like swimming, walking, or hopping on a stationary bike. They build strength without all that pounding on the joint. The high-impact stuff, like running or jumping, can unfortunately make things feel a lot worse. Now, making those lifestyle changes is absolutely key, but they aren't the only tools in the kit. The next layer of support comes from partnering up with your doctor. And these are all things you can discuss together to see what makes sense for you. Physical therapy can give you exercises tailored just for you. Certain medications can help with the pain. A cane or a brace can give you extra stability. And yeah, for some people, things like injections or even surgery, like a knee replacement, might be the right answer. The key thing here is that it's a conversation, a shared decision. Okay, we've talked a lot about managing pain, but now we're going to pivot to something that is frankly even more important. This is where we connect the dots between a sore knee and a much, much bigger risk. Just look at this number, 1 in 4. The CDC says 1 in 4 older adults in America falls each year. That is a massive, staggering statistic. And it's not just a number, right? Every single one of those falls can have incredibly serious consequences. And right here, this is the aha moment. This is the whole point. A painful, unstable knee from osteoarthritis isn't just an inconvenience that makes it hard to go upstairs. It is a major and way too often overlooked reason why those falls happen in the first place. I mean, it makes sense, right? If you don't trust your knee to hold you up, your balance is already compromised. So you see, this whole conversation about managing your knee pain, it's about so much more than just feeling better day to day. It's about preventing that one fall that could change absolutely everything. It's about protecting your ability to move, your health. It's about protecting your independence. So now that we understand that critical link, what do we do about it? What's the path forward? Let's get into the immediate, practical steps you can take to make moving around a whole lot safer. And honestly, the best place to start is right there at home. And we're not talking about huge renovations. Simple changes can have a huge impact. Getting rid of tripping hazards like throw rugs and clutter. Making sure hallways and bathrooms are well lit.
maybe with some night lights. And installing things like grab bars where you need them most, like in the shower.
So let's just boil it all down into a clear action plan. 4 simple steps. Number 1, talk to your doctor about your knee pain. Get that conversation started. 2, start some kind of low-impact exercise routine. 3, take a serious walk through your home and look for those fall risks. And 4, and this is a big one, share your plan with a family member or a friend who can help you and support you.
So we'll end on this thought. Every single step you take, every little thing you do to manage your knee pain and improve your stability, it's not just about feeling more comfortable today. It is a direct investment in your future. So the real question is, how are you going to choose to invest in yourself today to protect that independence for tomorrow?